Now, what if you have these kids who have this multitude of etiologic factors, child abuse, fetal alcohol exposure, chaotic environment, and all that kind of stuff? How do you treat them? There's no golden bullet for that. And with ADHD, stimulants are extraordinarily effective, okay? But with these kids that are multi-symptomatic, there's no one drug, that's going to just kind of magically turn the volume down on huge problems. So an approach that I think makes sense, and this is John Walkup also strongly recommends this, is instead of desperately trying to find a diagnosis, oh, this is bipolar or this is conduct disorder, say, look, this is a multi-symptomatic kid, okay, probably multiple etiologies. It's hard to say there's one specific diagnosis, which means there's probably no one specific medication that's going to work. But what you can do is you can meet with a family and you can say, let's decide on what is the single most severe symptom. This would be the symptom that causes the most personal suffering for the child, the most significant disruption and dysfunction in the family and at school. Okay, so it's the most disabling or the most suffering. And say, independent of diagnosis, let's see if we can just look at this single predominant symptom and then go to what medications are known to address that and try to treat that, okay? And oftentimes it's aggression, but it may be other things as well. And his point is that rather than getting lost in these debates about the diagnosis and this kind of stuff, if it really truly is one of these kids that has all this multitude of problems, is that when you can selectively and successfully turn the volume down on something like severe aggression, then a lot of the other behavioral problems tend to simmer down at least to some degree. Okay, and also that way we're not fooling ourselves into believing that we know what the hell's going on here. Okay, and I think that's being honest.